Hi, I'm Dr. Victoria Aimé, a plastic surgeon located in Scottsdale, Arizona. I'm sure you've heard of the word liposuction, but actually what we really do in our practice is body contouring. This isn't weight loss surgery. What this really is sculpting and highlighting the natural contours of your body to make you look the best. Many of my patients want the benefit of liposuction, but don't really know what it entails, and so that's why I put this video together for you. The initial consultation really is nothing more than a conversation between you and me discussing your goals. The most important point of our consultation is not to sell you on something or convince you to do something. Really, it's to bring clarity to the entire process and what we can do or can't do in achieving your goals. That's really what the entire point of our consultation is about. Some of the key factors that I will discuss with you during our initial consultation are: what are your goals in terms of which areas really bother you or you have difficulty losing weight in? What kind of timeline you're looking for? So do you have a big event coming up? Is there something that you have that you're planning for, a vacation, things like that? What's your budget? And who's going to really be helping you afterwards during your recovery? Some of my main questions that I get from my patients are: how bad is this going to hurt? How much time do I really have to take off from work? Do I have to have drains? Those are really some of the more common questions that people are worried about and they ask me during their consultation. And we're going to cover that in this video. So whenever you come to see me as a new patient, I'm always going to ask to know all about your medical history, any medical conditions you have, any medications you're on, any allergies to any medications you have, what surgeries have you had in the past, everything like that I want to know about so that I can give you the best possible care, and that includes safety in your care as well. So some of the things that key me into thinking maybe this isn't the right procedure for you, maybe this isn't a good fit for you, or number one, if you think this is for weight loss. Liposuction and body contouring is not a weight loss procedure. Another reason would be if you're on blood thinners or you have a clotting disorder, and that's part of the reason I ask you such a detailed history about your health and your medications and things like that during our consultation. One of the best ways that I can achieve your goals is by setting realistic expectations about what you are trying to achieve, if that's even possible, if you need more than one stage to achieve that. And that's a dialogue that we will have back and forth together. I've done hundreds of cases in body contouring, and I have a lot of experience guiding you in choosing the best possible procedure for you, but also knowing what to expect from the procedure. So patients really prepare for surgery starting at the consultation. So we're gonna have that conversation about what to expect, how much downtime can you expect to have after this procedure, who's gonna help take care of you. That's really where preparation starts. We're gonna talk about how you need to increase your protein intake. That really helps with wound care. We're gonna talk about how many days you really need to take off. I'd usually say at least a couple. All of those kind of mindset and planning, that really goes into us achieving the best possible outcome for you. Leading up to surgery, some of the changes I asked of my patients to make: number one, smoking. If you are using any sort of nicotine product at all, whether it's in a cigarette or vaping, it really needs to stop. And that needs to be for 6 weeks before and 6 weeks after your procedure. And the reason why is because it can increase your risk of infection. It can increase your risk of wound dehiscence or wound breakdown. These are all big problems and big complications that we can decrease the risk of by just stopping smoking and nicotine use. The next thing I would say is stopping the use of certain vitamins and supplements. So everybody wants to be healthier, and a lot of people are on a lot of supplements, but I always advise people to come off of those supplements for at least 1 week before and 1 week after. There are a lot of things that interfere with your ability to bleed and clot, and I want to have a nice clean slate for our procedure so you have less bleeding risk and less bruising and a better recovery. Nearly every patient is going to feel nervous before their procedure, and it's my job to help you feel comfortable and ready for the procedure. Very few patients actually get cold feet. The majority tell me I feel a little nervous, and that might be reflected in their heart rate or blood pressure going up a little bit. But really, once we get there and we've really planned for everything, dotted all the I's and crossed all the T's, most patients do just fine. Safety is my number one priority. So we are going to do your procedure 3 times. And by we, I mean me. I'm going to plan your procedure in my mind. Then we'll do your procedure, and then I review each procedure to make sure that I have done the best I possibly can every time I do that procedure, that I can learn or tweak things. And so specifically when I'm preparing for your surgery, me and my team, we are looking at your medications, we're looking at your medical history, we make sure we have all the supplies we need, everything is clean and sterilized, the environment is ready for you, all of our supplies are ready for you, all of our equipment is ready for you. Those are kind of the things that go on behind the scenes, just getting ready for this big day that's just for you. So when you arrive on the day of your surgery, the first thing we're gonna do is welcome you in. We're gonna have you change into a gown. We're gonna take some preoperative photographs. I'll put some marks on the areas we're gonna be working on. And then basically we're gonna just briefly review your discharge instructions. And then at that point, whoever brought you to surgery, your caretaker, your spouse, your friend, parent, they can either go wait in the waiting room or they can go out to coffee, whatever, and we'll give them a call about a half an hour before you're done. And then we proceed on to our procedure. So body contouring can be done either awake or asleep. My preference is actually to have patients awake for a few reasons. Number one, I think it's much safer. I can stay in the appropriate planes, and if I was to ever go anywhere beyond that, you would tell me right away because it would hurt. But number one, safety. Number two, I can actually ask you to roll onto your side, turn over, I can double check things, tweak things. So that's the second reason I really like awake surgery. And number three, you don't have the grogginess associated with general anesthesia. You just get up and you walk out of the room on your own 2 feet. And so there's really a lot less downtime to having awake liposuction or body contouring. That being said, some patients know that they have a really high anxiety level and they don't want to be awake, and that's totally fine. So they can undergo general anesthesia and we can do their case in a surgery center. But otherwise, if you choose the awake route, we just give you a couple of medications to keep you comfortable, something for pain, something for nerves, an antibiotic, something to prevent nausea. Really, that's it. And most patients are pretty walkie-talkie during the entire procedure. I hear a lot of stories about people's lives and I get to know them actually really, really well during the procedure. So once we have you in the procedure room, a couple of things I'm gonna do. So number one, we'll clean your skin off with some soap, some surgical soap. Then I'm gonna numb little discrete areas where I'm gonna make some incisions. And so these are all spots that we'll talk about before. They're usually very well hidden in clothing. Once we make those little numb spots, I'll make a tiny little incision. It's about 2 millimeters. Through all those little incisions, I'm going to put in a fair amount of numbing fluid. So this is really what makes this entire procedure possible while you're awake. That fluid is gonna have a few things. Number one, saline, which is kind of like water. Number two, lidocaine to keep you nice and numb and comfortable so all you really feel is vibration. And number three, epinephrine, which decreases bleeding and bruising during the procedure. So we're gonna put a fair amount of numbing fluid in. That takes a few minutes to get settled in. Once it's all settled in, then we can start our body contouring, our liposuction. I'll use a long cannula. It's basically like a straw that hooks up to a vacuum and vibrates, and it's gonna shake up those fat cells and then suction them right back out. You can see those fat cells come out into a tubing and into a container if you want, but you don't have to look if you don't want to. And then once those fat cells are out, they're out. And that's pretty much the entire procedure. At the end, we'll clean you up and we'll put you in a compression garment with some extra pads to help catch any fluid that leaks out. But really, that's the whole procedure right there. So I'm not alone while I do these procedures. I have a team that helps me, and primarily I always have a nurse with me. So there's somebody who is trained and knows exactly what to expect and anticipate, that's gonna be there monitoring vital signs, helping me get supplies, setting things up, and also talking to you and making sure you feel comfortable and that your pain is well controlled. A lot of people will ask me, how long should I expect to be there? It's a great question. I am a very meticulous surgeon, very much a perfectionist. And so I think I'm a tiny bit slower on that edge of things, but typically most procedures are in the 3 to 5 hour range. A lot of people will do like their tummy, their back, their neck. You know, some of these are shorter procedures. If we're just doing your neck, maybe an hour. If we're doing like your entire trunk, then that's gonna take us more like 3 to 5 hours. On the front end of things, we spend about 45 minutes, getting medications, signing consent forms, taking photographs, all those kind of things. And on the back end, we just make sure you're doing okay. We watch you for about 20 or 30 minutes just to make sure your vital signs are all looking great, your pain is well controlled, you're doing fabulous, and ready to walk out the door. So a common question I get is, how much fat can I have removed during one procedure? And the answer is about 5 liters. So in the state of Arizona, in most states, the safety guideline is 5 liters. So if we look at this bottle here, this is a 1 liter water bottle. So we can actually take 5 liters of fat and fluid out during a given liposuction procedure, which is a fair amount on pretty much anybody. So immediately after your procedure, after we clean off your skin, we'll put you in a compression garment. We put in these big oversized maxi pads to help catch that fluid. And then we'll watch you in one of our clinic rooms just to make sure you're doing okay. After that, whoever you choose to pick you up and take you home will arrive. We'll go over discharge instructions one more time. You'll walk out, and then pretty much you can go have whatever you want to eat or drink. Most patients go home and have a great nap, but basically you're gonna walk out of here feeling just fine. The other question I get often is in terms of pain, what can I expect in terms of pain? Really, it's not too bad. A lot of times people will tell me it's more like a soreness. I feel like I've done a million push-ups or crunches, but most patients do just fine on Tylenol and ibuprofen. For the first couple of days after surgery, I think it's probably one of the more cumbersome times, and really that's just because however much fluid we put in during your procedure, not all of that comes out with liposuction, and so some of that fluid is going to drain out through the incisions. So for the first couple, maybe 2-3 days, you're going to have drainage out of those incisions. So I have you change out the pads in your compression garment. But after that, the drainage is very minimal. It's better out than in. Part of the reason we put people in compression garments is that we want to squish out some of that fluid in those first 2 to 3 days. During recovery, I always encourage my patients to increase their protein intake. Anything is better than nothing in terms of this, but really you have small wounds on the outside of your body, but bigger wounds on the inside. So your body really needs a lot of protein to help heal. So that's number one, increase your protein intake. We talked about, don't go back to your supplements right away. Give those about a week before you start back. I want my patients up and walking and moving around. So I tell all my patients, about once an hour while you're awake to get up and just even walk to the refrigerator. Walk around the house, just anything to get you up and moving a little bit. And outside of that, those are really the main things I ask of my patients in that short-term post-op period. The majority of recovery really happens within the first 6 weeks of any procedure, really. So all of your healing, you're going to reach about 80% of the maximum strength of your scars within 6 weeks. And the majority of your swelling is going to go down within that 6 weeks. And that's not to say that you're not going to see results immediately, but you will see the swelling come down, the bruising go away, the incisions close. The majority of that happens within 6 weeks. You have another big drop off in those things within the next, 6 weeks after that, so the first 3 months, if you will. Between 3 and 6 months, your swelling still continues to come down, and that's why we take photographs so we can watch these changes and track these changes with you. And then by 12 months, you might have a little bit of swelling that you can tell maybe by the end of a day, but most people can't see it, just you. But really it takes about a full year. So after you're out of surgery, you can't get rid of us quite yet. We're actually gonna see you at 1 week, then 1 month, 3 months, 6 months, and 12 months. And then if you have any concerns, questions, anything that comes up in the meantime, we want to know about it. So please call us, please text us. We're going to call you, we're going to check on you. So really, we're just beginning that relationship that we started at your consultation. We're carrying it through to your procedure, and then we're going to follow you all the way through your healing. During that time while you're healing, I'm going to give you a little bit of homework. So starting at 1 week, when I see you, I'm going to talk to you about scar massage. Scar massage is very important. So your body wants to form a scar tissue inside all these areas we've worked on. And we want you to make that nice and soft so the skin lays nicely and we can't really tell that anything was ever done there in that sense. So scar massage, I tell all my patients, if you've ever had a manicure, it's just that same kind of firmness and pressure. I want you to knead those areas like you're kneading dough. We want to soften up that scar tissue and make it move and look natural with you. You don't need to buy anything special for that, a lipo roller. You don't have to have lymphatic massage if you don't want to. It's not required, but really scar massage is really important. The other thing I give to patients as homework is that if you go out in the sun, I want you to put sunscreen on those little incisions just so that the color heals perfectly. I get a lot of questions from patients about, what to expect in terms of weight gain, weight loss, how long do these results last for me? And the truth is that the body is full of stem cells. It has the ability to make new fat cells. And patients that gain a ton of weight and lose a ton of weight, they're gonna see that in these areas. But really what your body does is kind of take a path of least resistance. So most of the time when we see weight gain and weight loss, the fat cells that you have remaining will either grow or shrink as you lose weight. So, it would look weird, excuse me, it would look weird if there was skin on muscle. So we leave a little layer of fat between the skin and the muscle, and those cells have the ability to expand and decrease if you gain or lose weight. But, people don't preferentially make a bunch of fat cells in another area and look weird. The whole idea is that you look natural for the rest of, your life, basically. Again, this isn't a procedure for weight loss. This is really a procedure for you to look and feel your best. This is going to be aimed at giving you a natural body contour that really highlights all of your natural features. So I really hope that this video was helpful and informative for you. Thanks for watching this video. The next step would be to schedule a one-on-one consultation with me. You can schedule a consultation with me online at your convenience or over the phone, whatever works best for you. My website is metropolitanplasticsurgery.com, or you can call or text me directly at 480-550-9493.